It's regarded as an extremely safe procedure nowadays. It's been done by dentists in various countries around the world for probably up to 30 years. It's only been relatively recent legislative changes with dental boards and with APRA that's allowed to legally do it in Australia for the last 4 or 5 years or so. So cosmetic injectables involves doing relaxant muscle relaxant injections to the facial muscles, so get rid of lines and grooves in the face, and it can bring about a significant improvement in the appearance of premature aging in people. So it can give you a more relaxed, refreshed look on the face. Along with that, cosmetic injectables for things like dermal fillers, very popular again. One of the most popular areas is around the lips, giving full, sexy, healthy looking lips, and that's one of our big demand areas. And nobody can give injections like a dentist. And there's nobody has that level of experience. So, and also nobody's got the knowledge of what's going on inside the mouth and how that relates to what's happening with the rest of the face. So I think we're in a unique position to be able to know the facial anatomy extremely well, know oral anatomy extremely well, and know how those two harmonise together. So dermal fillers can be done for all sorts of things. We can do it for temples, we can do it for bags under the eyes, we can do it for nasolabial folds, what's called marionette lines. There's all sorts of things we can do with dermal fillers to even out little depressions and deep grooves on the face and bring about a more youthful looking appearance. The Australasian Academy of Dentofacial Aesthetics was the original body that trains dentists to do it. At the moment, there's probably something like 2,000 dentists in Australia who've undergone training through ADFA. I did my initial training. I've done all the training courses that ADFA provides over the last 4 years or so, and also done training through the American Academy of Facial Aesthetics, which is the American equivalent. And ADFA has got a much higher level of training than the American Academy, so it's recognised as probably the best form of training you can get in Australia nowadays for dentists to do that. So they're now actually training some medical practitioners to do the procedures as well through ADFA, through recognition of the fact that ADFA is probably the most recognised training body for cosmetic injectables. We don't just do cosmetic injectables too. One of the most common forms of treatment is for tension type headaches and migraine. So I first got into it because of family associations with severe migraine problems, and treating migraine with muscle relaxant injections is an extremely potent way of doing so. We have other ways of treating it as well, so it tends to be the last resort. But quite often people have tried absolutely everything else. They come to us as a last resort to get it properly treated, and it can make a huge difference. Some cases people have what's called chronic migraine. I really feel extremely sorry for those, because chronic migraine is described as migraine that occurs for 15 or more days in a month, and you can imagine what that's like. 3 million Australians suffer from migraine. Fortunately, not most of them don't suffer from chronic migraine. It can be terribly debilitating and a severe source of depression.